T1 TSE sagittal. Plan the sagittal slices on the axial plane and angle the positioning block perpendicular to the line between the medial and lateral malleoli. Check the positioning block in the other two planes. An appropriate angle must be given in the coronal plane, parallel to the tibia.
PDTSE axial 3 mm. Plan the axial slices on the coronal plane and angle the positioning block parallel to the tibio-talar joint. Check the positioning block in the other two planes. An appropriate angle must be given in the sagittal plane, parallel to the tibio-talar joint. The slices should be sufficient to cover the ankle joint from 2 inches above the tibio-talar joint down to the plantar aspect of the foot. Using saturation bands above the axial block can reduce arterial pulsation artifacts.
PD fat-saturated coronal. Plan the coronal slices on the axial plane. Angle the positioning block parallel to the line along the medial and lateral malleoli. Check the positioning block in the other two planes. An appropriate angle must be given in the sagittal plane or parallel to the tibia. Slices must be sufficient to cover the ankle joint from the Achilles tendon to the midfoot. Using saturation bands above the axial block can reduce arterial pulsation artifacts.
Indications for ankle MRI scan. Marrow abnormalities, for example, bone contusions, osteonecrosis, marrow edema syndromes, and stress fractures. Synovial-based disorders, for example, synovitis, tenosynovitis, bursitis, and ganglion cysts. Congenital and developmental conditions, for example, dysplasia, tarsal coalition. Achilles tendon disorders, for example, tears, tendinitis, tendinopathy. Infections of bone, joint, or soft tissue, for example, osteomyelitis. Osteochondral and articular cartilage abnormalities. Abnormalities of other hind foot tendons. Plantar fasciitis and fascial rupture. Neoplasms of bone, joint, or soft tissue. Posterior tibial tendon disorders. Peroneal tendon disorders. Intra-articular loose body. Sinus tarsi syndrome. Avascular necrosis. Fibromatosis. Contraindications. Any electrically, magnetically, or mechanically activated implant, for example, cardiac pacemaker, insulin pump biostimulator, neurostimulator, cochlear implant, and hearing aids.